Did he bring it
They're
with him?
stream, but they're also
Yeah.
online.
Oh,
So you can pick them up later if you don't have time.
Oh, okay, cool.
Just ask either Colleen or Martin, they'll tell you when.
Perfect.
Yeah.
You guys are high tech.
We're trying to be.
That's awesome.
We have it streaming on TikTok and we're recording.
Oh, that's awesome.
What I paid for this and I'm trying to get this for $60.
Just double check, make sure you're up. All right, so we're going to go ahead and get started. So Marty Donovan will be the one speaking. For those who don't know him, he is the owner. He's also a pharmacist, clinical nutritionist, and herbalist. And now I'll turn it over to you.
Good morning. Sorry about the
Yay.
delay. Technology is always the villain. But when it works, it really is nice to have that. Well, welcome this morning. Thanks for coming. Again, this is one of our health talks we're doing. We want to have a regular program of doing these about once a month and on various topics. We did last month, we did heart health part 1, which related to high cholesterol. This one is heart health part 2, which deals with blood pressure, and then heart health part 3, which would be next month, be on blood sugar, like diabetes, that kind of thing. So these are all extremely important for overall good health. But my goal as a clinical nutritionist is to look at the underlying reasons behind things, not just you have high blood pressure, here's your lisinopril, or here's your medication. Let's deal with this from a whole body perspective, and I'll talk a little bit about the medical thinking about blood pressure when I get to natural ways of dealing with this. So again, today's topic is dealing with blood pressure. By the way, anytime you have a question, please let me know. I'd like to make sure you're clear while we're working through this. You have a complete set of slides that you're seeing on the screen, so you have a lot of comprehensive, not a lot of note-taking necessarily, but if you have a pen, you want to do that, feel free to do that. But I'd really like you to ask a question at any time. Yes?
Just a question, can we, since we missed the first part, can we get the notes from the first one?
The answer is yes, we can do that. We've had some, again, technology problems. 2 of my talks were erased. So we're going to post them on our website.
Okay.
We have a couple talks, but not everything we've done so far. We've done about 5 of them so far. And I think,
They're free.
and 2 of them were lost. So hopefully this one will hold. But yes, we can do that. The best thing to do would be to talk to my daughter, Colleen, and leave your email address, and she can send you that.
That's great.
And if you want to pick it up at the store, print it out, we can do that for you as well.
Okay.
Okay, so here we are with heart health and blood pressure. So what are we going to talk about today? First of all, let's just find out what blood pressure is at all. And why is healthy blood pressure balance important? What are the effects of both low and high blood pressure? And we'll talk about low blood pressure, but really the focus is on how do you deal naturally with high blood pressure. That's what most people deal with. If you're one who does deal with low blood pressure, talk to me separately, and I'll be glad to talk to you about that. It's a completely different situation, and actually more life-threatening than a high blood pressure situation. So what can cause it to rise? What is going on behind this? And then how can we normalize it naturally? So that's really what we're trying to deal with today. So getting into the basics, what is blood pressure? You see the blood vessel, and they give you some images where basically the blood is flowing through the vessel, and the presence of that fluid puts pressure on the blood vessel itself. So it's the blood pushing against the blood vessel. And when you see something like this, atherosclerosis, which is hardening of the arteries, that causes a narrowing. And anytime you narrow something, you increase the pressure. So the less space it has to flow, the more. That's why hardening the arteries is a high risk factor for high blood pressure. Typically, it's measured with a sphygmomanometer, a blood pressure cuff, and a stethoscope. Okay, so what do the numbers mean? The typical 120 over 80. The top number is called the systolic, and this is the force exerted on the blood vessels when the heart is actively beating, when it has just beaten, and that's the highest number, essentially, in your blood vessels during that time. And then the diastolic is a resting, when it's between beats, which is very brief, of course, because you have to keep beating your heart, but it's the lowest number that occurs in the blood vessels during the process of the heart beating. So how do we look at and interpret blood pressure in general. A lot of factors involved. Blood pressure readings will always vary during the day, moment to moment. And that is a life-saving function. If you suddenly sprint out the door, your blood pressure better go up or you're going to fall over because you're not getting enough blood to your brain. So up and down happens all the time, and that's to be expected. The thing that's important is that you should never, ever prescribe medication, have your doctor prescribe medication based on one reading. That is very, very dangerous, and I'll talk about that in a minute. These are the typical categories now they talk about what's considered normal. These have changed over the years. When I was in college back in 1976, standard blood pressure was the 120/80. But for every decade over 30 you could add 10 points to the top number. So if you were 50 years old, your top number at 150 would be considered fine. That's old thinking. Now, in fact, it's even gone down, where 120/80 was considered normal. Now they're saying technically 120/80 is elevated. So 119/79 is what they now consider. And I think the reasoning behind that is that there's such bad consequences for extended long-term high blood pressure. And so kind of the lower the better is, the lower is not better. You know, we'll talk about hypotension, and that's too low blood pressure. So there is a balance you need to have. But essentially the normal would be less than 120/80 over less than 80, elevated 120 to 129 over or less than 80. Doctors normally won't give medication, hopefully, for those readings. Then you get into the high blood pressure, the beginning, stage 1, 130 to 139 over 80 to 89. High blood pressure, 140, or the higher stage, 140 over 90. And then hypertensive crisis, higher than 180 over 120. Okay. One of the important things to understand when you go to your doctor is this is the worst place to have your blood pressure checked. Have you heard of white coat hypertension? Are you familiar with what that means? That means you go to the doctor, you're not happy to be there. Who wants to go to the doctor? Who wants to go? That's right. Who wants to go to the dentist? You know, that kind of thing. You don't know if you're going to get bad news. You don't know if you're waiting for a bad lab result. You might have been late. You're rushing. You know, you had to run to get there on time. Staff gave you a hard time. Whatever's going on. So stress can cause your blood pressure to rise. Like I mentioned before, blood pressure goes up and down throughout the day. When you're in the flight or fight response, and the flight or fight response can be, I'm being attacked, right, and I need to be strong, my heart is racing, my blood pressure's up so that I can defend myself, or you're sitting there worrying about you can't pay your bills or whatever's going on, the same thing happens. Your body blood pressure will rise and your heart rate often will race when you're not even doing anything. So that's your body's normal physiological response to things like adrenaline. So you can quickly, it's essentially a life-saving function. So going to the doctors can be stressful, and that can then create a problem. So if you arrive and your blood pressure's up, ask to be checked maybe 15 or 20 minutes later. Normally, in the course of conversation, you calm down and then get it checked again. So if you're taking your own blood pressure, there's some things to consider. You want to make sure you do it when you're relaxed. You don't want to go running up and get the mail and come back and take your blood pressure. You know, you want to do it when you're relaxed. You want to be well hydrated, plenty of fluids, because when you're dehydrated, that will affect your blood pressure both up and down. And then you want to generally on an empty stomach and not near caffeine, because caffeine is a stimulant, can raise your blood pressure. So your blood pressure will vary throughout the day. So you might want to, and I would recommend getting a cuff, having it on hand. It's a general free way, once you pay for the cuff, of just knowing what's going on with your body. It's a body indicator. And in clinical nutrition, I ask people a lot of questions about where are you now, and so many people just don't know. You know, it's easy to do this. You know, just take your blood pressure so you know, okay, I'm in normal range, great. You know, check it once a month or something like that. Or if you're on medicine, you want to be careful of getting too low blood pressure. We'll talk about that in a minute. So in general, blood pressure will vary throughout the day, depending on when you've eaten, how much activity you've had. In general, when we wake up in the morning after a good night's rest, your blood pressure is normally the lowest of the day. You want to make sure your cuff fits properly. There are measurements on the cuff when you buy it. Make sure you take the circumference of your arm and make sure you're using the right size cuff, because if you don't, you won't get a good reading. When you take your pressure, your arm should be equal to your heart. If that gives you the best reading. So elevate your arm. Take it on alternate arms. Generally, you'll find there is a slight difference on the arms. The thing that's important, though, is use the higher number of the two. And then if it's more than just 5 points out on one side, this is the top number, it's systolic. If it's more than 5 points out on a regular basis, let your doctor know. That could be an indicator something's going on. Oftentimes with hardening of the arteries. Yes?
Does it matter whether, I know the last time I went to the doctors, they measured it on my lower arm. Does it, with the blood pressure cuff, does that
Boy,
make any difference?
in general, my recommendation is to use the upper arm. Do not use a wrist, do not use a finger. And I haven't heard of one on your lower arm. So I don't know go ahead, Connie.
Yeah, they do those now.
That's now? Okay.
They are usually automatic. They wrap around your wrist. They're actually the kind they use for my infusions because usually both my arms are.
So that's in the doctor's use now?
Yep.
Okay, all right. Then that's technology I was not aware of. Back in the olden days when I was practicing pharmacy, it was don't ever do a wrist because you can't really compress. You've got a bone there. And with the arm, it's spongy, most of it. But here you're hitting a bone and it's preventing you from compressing. But if the technology's improved, and it does
It's a
all,
specialized one.
yeah,
to
it
wrap
does all
around.
the time,
Yeah.
then yes. With authority, I tell you yes. Okay, so why is blood pressure balance important? A healthy blood pressure is really critical to allow free flow of material through your blood vessels to get to the destination. Organs, your extremities, people with cold toes, oftentimes they've got poor circulation from, maybe there's thinning in the blood vessels, so they're not getting good flow. But without the proper oxygenation, technically organs can die. And that's like with a heart attack, you get a blockage to prevent you from getting oxygen to your heart, and part of the heart muscle actually dies. So it's really, really important. Normal blood pressure, again, is considered in the 120/80 range, and then both too low and too high can be an issue. Too low is called hypotension, and too high is the hypertension. Okay, so let's talk a little bit about hypotension or low blood pressure. It's generally considered to be reading lower than 90/60. So that's really low. I don't like numbers, the top number below 100, and even 105 I don't really care for, because you really need to have your blood pressure there when you need it. So, but the thing is, what's low for one person is going to be okay for another one. So again, you may find that, for you, at 100 I feel great. Other people, they feel dizzy. So it really is something you have to take into account the individual, not just the number. Okay, so what can cause low blood pressure? Again, we're not focusing on this, but these are just some of the things to be aware of. If you see that your blood pressure is low, being dehydrated, fluid is what keeps your volume up, and therefore, when you're dehydrated, it's very possible you can have low blood pressure, but although dehydration sometimes can cause high blood pressure because your body's reacting to low blood volume and trying to force your pressure up, so it's not a guarantee. Long-term bed rest, pregnancy, certain medical conditions and even medications, especially high blood pressure drugs, can make your blood pressure go too low. Lifestyle changes using natural supplements can sometimes cause hypotension in someone who is on medication. The logic behind that is that drugs lower blood pressure. Regardless of where you are, if you take a blood pressure drug, it will lower your blood pressure because it's not working to normalize anything in your body. It's just driving your blood pressure down from a variety of different means. Natural things help to normalize your blood pressure. So if you're too high, it can bring it down, and even if you're too low, it can even help to bring it up. So if you are on high blood pressure medicine and you decide to make any changes, and I have here some list of things: you lose weight, you start or increase exercise, stop smoking, or you begin to take natural supplements for healthy blood pressure, you may find that as you normalize your pressure, now the drug is driving you too low. So monitoring your own pressure and then talking to your doctor, say, hey, look, I was 120 over 80 and now I'm 110. Talk to them and say, well, okay, maybe we'll cut it in half, maybe we'll stop it, and let the doctor decide what to do. Don't ever stop it on your own. And then, again, here's some of the things that can be an issue. If you have low blood pressure, you can be dizzy, lightheaded, see stars, fainting, unsteadiness, blurred vision, confusion, tiredness, nausea. A lot of these symptoms may be amplified by what's called postural hypotension, which means you change positions, like you sit and you stand up and you go, whoa, whoa. So it's a change of position inducing low blood pressure. And some of the issues with having long-term low blood pressure can be frequent falls. You know, if somebody is complaining of a fall to a doctor, first thing they should check is their blood pressure. And then, again, if it continues, it can actually cause, due to the lack of blood flow that I said was so important for healthy blood pressure, you can get change of blood flow to your brain, your heart, other organs, and you can even get a stroke, heart attack, kidney failure, and even shock from having too low blood pressure. Okay, so let's now talk about hypertension, which is really the focus of today. This is when the heart, the pressure is higher than normal, and therefore the heart needs to cause more blood to flow, and it basically is putting more stress on the heart to do a job it should not be doing. It shouldn't have to pump that hard, but it's doing it to keep you alive. So basically, there is a reduced level of oxygen due to the low blood pressure, or not enough circulation. It might be due to hardening of the arteries, whatever, and so the heart is beating harder in order to do that. This can even cause the heart to get larger and get weaker. It's not like, a bodybuilder where you're getting strong. It's an abnormal size of the heart that is basically from wearing it out, trying to push the blood through your body. So here's some of the consequences, or some of the statistics about hypertension. Although it poses serious health threats, it's generally considered to be non-symptomatic. It often goes untreated. And so some of the numbers, 1 in 3 adults worldwide have high blood pressure. So this is not a minor problem. 1 in 4 have pre-hypertension. So again, they would be the people that are 120 over 80 up to like the 130 mark. And then 1 in 5 adults with high blood pressure don't even know they have it. So that's the silent nature of it. It goes untreated. And then estimates are, based on current trends, 7% more Americans will have high blood pressure by 2030. And so it shows you this is not a problem that's going down. And when you look at the girth of our American society, the larger body size, this is a primary risk factor for hypertension. Okay, so what happens if you have high blood pressure and it just doesn't get controlled? It can actually cause high cholesterol, it can cause kidney and eye problems, it can cause poor circulation in the legs and feet. Some of the real severe consequences are heart attack, heart failure, stroke, kidney failure. And then if you have, again, I mentioned that it's a silent condition generally. If you do have symptoms, that means you actually probably have extremely high blood pressure. So if you're getting symptoms, this is like the end of a road. You know, you're about to have a heart attack or something like that. Some of those symptoms can be headaches, dizziness, blurred vision, edema, or swelling. And then some of the scary statistics, 54% of strokes and 47% of heart disease are related to high blood pressure. So again, when you talk about 1 in 3 having high blood pressure, that's a significant cause of these conditions. And again, no symptoms, they call it the silent killer. Unfortunately, sometimes the first symptom is a stroke. You have no clue what's going on, and then you have a stroke and you die. So you have no warning. So that's why they call it the silent killer. Something to pay attention to. There are actually 2 different kinds of hypertension. Primary or essential, which is probably 90% of people. This is not caused by a medical condition. So it may sound funny to qualify by what it isn't. But let me just go up one more slide. Okay, secondary is blood pressure caused by another condition. So for instance, you may have, as it says here, kidney disease, Cushing syndrome. You can even take medications that can cause high blood pressure. So the cause is not general, it is specific. And if you can cure that or take care of that secondary, for a primary problem, then secondary hypertension may go away as a consequence. So they call that, it's funny when you look at the different ways of medical thinking these days. American Heart Association would call it that primary or essential hypertension is non-curable and unsure cause, where with secondary it has a cause and it's curable. But as we'll get into the primary, it actually has causes, and that's what we're going to talk about today. It's not a matter of my only hope is to take this pill. My hope is to do some of the things that can change the dynamics within my own body. So again, the primary is not caused by another medical condition, and they call that primary or essential hypertension. And again, some of the causes can be related to mainly lifestyle. So obesity, lack of exercise, smoking, or even, I think even chewing will affect that. Alcohol consumption, an imbalance in salt intake, the improper sodium and potassium ratio, and I'll get into this more thoroughly, but the focus on sodium is not correct in my opinion. Low salt. So we'll talk about that. Yes, it's important to regulate it, but it's not the be-all and end-all. There's actually health dangers of not getting enough salt in our system. And then also it can even be due to genetics. So the secondary, again, is related to another condition. So it's a side effect, essentially, of either a health condition or a drug that can be causing that to happen. So what are the things that can cause hypertension to rise? We can classify these broadly under two categories, excesses and deficiencies. And actually in clinical nutrition, you can do this with almost every health condition. What is going on in the body that is causing this symptom to show up? And excesses and deficiencies are a very common way of looking at and grouping these together. So some of the excesses, again, we talked about being overweight. It accounts for 65 to 78% of the cases of hypertension. There is a primary cause. This is not just we don't know what's causing it. There's lifestyle factors. Here's a pill, try to lose weight, that kind of thing. You really need guidance on how do you go about achieving a healthy body weight for you, and in all likelihood, your blood pressure problem will go away, and in all likelihood, your diabetes will go away, and sometimes your cholesterol will go away. So they're all interrelated. That's why this talk is about three different things, but they're all under the same umbrella of body weight in one way or another. Smoking certainly increases plaque buildup, which then narrows the blood vessels, which causes high blood pressure. It also is a direct stimulant. Caffeine also is a direct stimulant, so if you're doing a regular caffeine push throughout the day. A big deal, and this also centers on what's going on in my talks about cholesterol, blood pressure, and blood sugar, is something called insulin. Insulin and insulin-resistant syndrome. Insulin is the hormone that your body releases when you eat sugar. When you eat something, carbohydrate, your blood sugar rises. The body responds to that and sends out insulin from your pancreas to bring your blood sugar level back down again. When it shows up, it will either put the sugar into your cells to burn as fuel, or you don't need the extra fuel, it'll go into body fat. So insulin is a storage hormone. When you have an excessive high carbohydrate consumption, sugar consumption, continually throughout the day, you're constantly stimulating the release of insulin, which is a very bad thing. What happens then is your body kind of says, I'm tired of being stimulated this way, and it takes more and more insulin just to bring your blood sugar level down. Now, I'll cover this very heavily next month when we talk about blood sugar, but the bottom line is that when you have excessively, and you can have high insulin levels, but regular blood sugar levels for 10 years before your blood sugar level finally rises and you get diagnosed with prediabetes. So if the doctors would check insulin, you know way 10 years beforehand, you could prevent it from even happening. And I've talked to many people. I say, have your doctor check my urine, so they won't check it. What do you mean they won't check it? They won't check it. I don't understand. So that is a big deal. I would insist, it's my insurance, it's my body, or whatever. If I have to pay cash because the insurance won't pay for it, I'd like to know what my insulin is. If you feel you're in a category of possible insulin resistance. But anyway, so the three-legged stool related to insulin resistance syndrome is meaning when you have this high insulin all the time, there are three very common symptoms that happen over time. One is high blood pressure, one is high blood cholesterol, another one is high blood sugar. So it's you talk to any type 2 diabetic, you're going to say, are you on blood pressure medicine? Which one are you on? Are you on a cholesterol medicine? Which one are you on? That's just the nature of the insulin problem. So this is a big deal in the cause of hypertension. That insulin, high insulin, then can cause hardening of the arteries. It irritates the lining of the wall, causes plaque deposition, and that is the primary cause of hardening of the arteries. And certainly a chronic stress response. Again, that's the flight or fight. If you're someone who's type A, who's perfectionist, who you can't do the best ever, you just have to keep on pushing, or you're just under chronic stress. You might be a primary caregiver for someone who's terminally ill. There's lots of different reasons for chronic stress, but they are potential for causes of the hardening of the arteries. And then your own internal anxiety, anger. If you're an angry person, you're in the flight or fight mode all the time. So some people actually have high blood pressure because they're constantly stimulating their adrenal gland to release adrenaline and things like that drives up there. So looking at your lifestyle, the way you react to people is really very important. Now, on the other hand, we just talked about excesses. There can also be deficiencies. Lack of exercise. Exercise is a big deal when it comes to healthy body weight, health of your heart, health of your circulation, things like that. Insomnia, less than 5 hours a night of sleeping has 5 times greater risk for hypertension. So sleeping is really very important. Low nutrient intake, there's a variety of things where deficiencies come into play. One is magnesium. Magnesium is like the relaxant of muscles, so if you're prone to leg cramps or restless legs, taking a good dose, 400 or 500 milligrams of magnesium a day can do that. Your blood vessels are a tube wrapped in muscle, so sometimes magnesium deficiency is not allowing your blood vessels to relax either, and that can be a cause of hypertension. Vitamin D, I'll be talking about the drugs for hypertension in just a minute. One of them is a family called ACE inhibitors, lisinopril, lisinopril are 2 of those. And vitamin D acts like an ACE inhibitor, so it acts like a natural blood pressure lowering agent all on its own, in addition to the 100 other benefits vitamin D has. Omega-3s are good for your heart in general. They reduce inflammation. I mean, they're a big deal. And deficiency, again, has been associated with high blood pressure. Low vitamin K. Vitamin K is an overlooked vitamin. It's really very important for healthy bone function, but it also is involved in way blood vessels relax. It also prevents hardening of the arteries, helps prevent calcium from being deposited on your artery walls. And then potassium. Potassium is an overlooked mineral as well. In fact, I'm about to get into the sodium and potassium relationship, so we'll talk about that as we go through this next part. Okay, so I'm sure if anybody in here is on blood pressure medicine, the doctor may have talked to you about the DASH diet, which is a low sodium, very, very low sodium diet. The complication is that there is a balance between sodium and potassium that really needs to be in place. And the more important component is, do I have enough potassium related to calcium? So it's recommended to consume 5 times more potassium than sodium, but most adults eat 2 times more sodium than potassium. So the ratio is upside down. Sodium causes water retention, which again can increase blood pressure. So the ratio itself is more important than the amount of salt. As you can see, if you're eating 5 times more than it doesn't matter how many milligrams you have, as long as you're in the ratio of 5 times more potassium and sodium, you're going to be great. So if you eat a lot of processed foods, and our primary source of sodium in our diets are from processed foods. the microwave meals, the things that are the canned soups, all these different things are just loaded. They use it for flavor enhancing and that kind of thing. So if you are eating a lot of processed foods, then it is almost certain that you are excessive sodium compared to potassium. The recent survey shows that Americans consume 3,300 milligrams of sodium, which is about 1.5 teaspoons of salt per day, and about 2,600 milligrams of potassium. But the recommended amount is 2,300 of sodium and 4,700 of potassium. Now that's a 2-to-1 ratio. Again, that's acceptable, but it's better to go higher on the potassium side. So if you were to eat that way, you'd be fine. But again, it would be better to go higher.
Marty?
Yes.
Does it make a difference what kind of salt? I mean, we have your typical iodized salt, Himalayan salt. Does the type of salt matter, or is it just mostly the ratio?
When you're adding salt, it could be Morton's table salt, it could be Himalayan, Celtic, all the different ones. The healthier choice is the colored salts, either they're gray or pink, that kind of thing.
Yeah.
But the amount, the color is from other minerals. Like instead of just sodium chloride, which would be Morton's white table salt, it'll have potassium and calcium and magnesium. That's what gives them the color. The problem is that even of those salts, about 95% of it is sodium. So there's really very little difference to the body when it comes to sodium ratio between the regular table salt and the more natural salts are healthier because the white ones, they bleach and they do other things to them that are not good for you.
So even like a Himalayan salt is better than a sea salt, because sea salt is typically white, or does it not? I'm still not quite sure. It's better to do the colored salt, like the pink.
The answer is there's probably no difference for the sodium impact on your body. It's better to pick a more natural source if you're going to use salt. But generally, those are not the area where we err, unless you're using half a salt shaker when you eat a steak or something like that. It's the sodium that's hidden in foods that we're not aware of. The fast food, the packaged foods that you get. So potassium itself has a relaxing effect on your arteries. It keeps your muscles from cramping. Again, helps to relax the blood vessels, allowing blood flow. Research shows that low levels of potassium significantly impacts blood pressure, especially related to the amount of salt in a typical American diet. Here are some examples of foods that are high in potassium that you can look for. You can Google it and find them to try to increase these: sweet potatoes, tomatoes, spinach, beets, black beans, avocado, wild salmon, butternut squash, lentil, chickpeas, Swiss chard, apricots, cantaloupe, watermelon, mushrooms, and tuna. Now, again, the amount you get is important because the need is so high. Again, we want to be in the 5,000 milligrams a day range. We sell a potassium supplement. It's 99 milligrams. You cannot supplement well unless you're really deficient. There's no need to take a potassium supplement. The reason for the restriction is because potassium is one of those really important minerals that has to be in the right balance for good health. Too low is life-threatening, and too high is life-threatening. It can actually harm your heart to have too much. That's why if you're on, say you're on a blood pressure medicine like a diuretic, and they give you a potassium prescription, they're about 8 times stronger than what you can buy over the counter, because you need it to offset the loss of potassium when you urinate a lot. So that's the difference between them. So the best way to supplement potassium is in your diet. It also encourages you to have more healthy foods, and that's really the bottom line. So rather than taking a pill, have a good salad and that kind of stuff. Okay, so how do we normalize blood pressure naturally? Well, first of all, let's talk about the drugs themselves. So we're talking a different of philosophy. There are a lot of different choices. I picked out 3 of the most common ones that are categories that are used when the doctors you have high blood pressure, they're going to start you off. One is diuretics. HCTZ is hydrochlorothiazide, furosemide, chlorthalidone. What do they do in order how they work? They cause you to go to the bathroom. They cause you to urinate. So increased urination then decreases total body fluid, which decreases your blood pressure. Side effects are potassium loss. That's, again, why they may have to prescribe when they give you a pill and then they have to prescribe a pill to counteract what the other pill is doing. That's a very prime example of that. So potassium loss is a danger, and again, potassium level is really important for healthy blood pressure. So here they're giving you a drug that causes one of the problems associated with blood pressure in the first place. Headaches, dizziness. Next category, ACE inhibitors. That's the one that vitamin D acts like. Lisinopril and placinopril are two common ones. They work by relaxing the blood vessels and thereby open up the amount of space the blood has to flow, which reduces the blood pressure. Side effects with this are potassium retention. So here you have a drug. This one's causing potassium retention. So if you're using one of these, you want to be careful of the list on the high potassium. So you want to go let your doctor check your blood level and see where you are for safe use of these products. Other side effects, fatigue, dizziness, headaches, and cough. And if you notice, dizziness is on all of these because of low blood pressure, which is one of the things that they can cause. Beta blockers is another common one. Atenolol and metoprolol are two very widely prescribed ones. These actually cause your heart rate to decrease. And thereby, again, the systolic is your heart is pumping and causing blood pressure to go up. Well, you have less beats, so there's less pressure overall. These can deplete a very important nutrient in your blood called coenzyme Q10. So if you're on one of these drugs, you should absolutely be on a CoQ10 supplement. CoQ10 is an energy component made by every cell of your body, and certain drugs will deplete that. The statins, which for cholesterol, are another one that deplete CoQ10. So anybody on a statin should also have a CoQ10 supplement. Again, other symptoms, fatigue, dizziness. There's dizziness again, poor circulation, and headaches.
If you're not on the beta blockers, I mean, there's all this stuff out there about CoQ10 now. Do most people need that if they're not on these drugs?
CoQ10 is actually healthy for anybody.
Right.
There's no
Supplement for it.
yes. There is no downside to taking it, so there's no harm. As we get older, part of the process of aging is we have less energy. That just happens with the aging process. So taking it as you get older could be considered to be a healthy, and it keeps your heart healthy. And it's funny, the main thing, say you take a statin in people, one of the main problems is muscle pain. That's from low cellular energy, which is caused by low CoQ10. So taking CoQ10 will often remove the side effect of a statin. The better way would be to remove the statin, but if you're going to take it, to do that. So if you can keep your cellular energy up, then you may decrease essentially the aging process or the effects of the general aging process. So it's just keeping your body healthy overall. And then bottom bullet, these do not deal with any underlying condition. You don't have a deficiency of hydrochlorothiazide. You don't have a deficiency of atenolol. You're just merely taking a drug to lower your blood pressure. So how do we normalize it naturally? These are things that you can do to help to, again, mitigate some of the issues and the end result, which could be cardiovascular disease and damage. Number one, you want to modify your diet. And there are a lot of things involved in a healthy diet, one of them being inflammation. There are a lot of foods that are pro-inflammatory and a lot of foods that are anti-inflammatory. Getting back to the processed food compared to regular food for potassium, the other problem with processed foods is they're usually highly inflammatory. So there's another reason to stay away from them. And by the way, one way of looking at choices between food, I can have a nice green salad or I can have a plate of French fries. The one is doubly good and one's doubly bad. If you have French fries, not only are you eating something bad for you, you didn't eat something good for you. And so if you get a salad, doubly good because you're not eating something bad and you are eating something good for you. So the motivation is there to try to not treat yourself, but pay attention to your body as what it needs. So in terms of an anti-inflammatory diet in general, the Mediterranean diet is one of the healthiest based on research. And it is high in lean meats, fruits, vegetables, whole grains, and healthy oils. You want to eat more fruits and vegetables, which again is part of the Mediterranean diet, and that will again help with your potassium level compared to your sodium. Losing weight is a big deal. As mentioned before, it's a high percentage, up to 70% of people, their blood pressure is caused by obesity or by being overweight. You can measure this yourself at home. One is to use a BMI calculator. If you've never done that before, go online and just Google BMI calculator, you'll get a little site, you put in your weight and your height, and it will give you a number, and it will tell you where you fall in this BMI range. Between 18 and 25 is considered normal range. 25 to 30 is overweight, and 30 up is obese. So you want to try to get into the normal range. So that's one method you can use to help judge where you are. And the other is to do what I call hip-waist ratio. You want to measure around the widest area, like around your belly button, and you want to measure where your hip bones are. And you want your hip bones to be bigger than your belly. So it's called the hip-waist ratio of 1 or lower. And that's, again, a good measure. And if you're in the process of losing weight and you're exercising, you may find that you're not losing it as fast as you like. This is one way to help put a little perspective on that, because if you're exercising, you're actually gaining muscle mass, which you want to do, and muscle weighs something. So you can lose 5 pounds of fat but gain 5 pounds of muscle, and you have no change in your scale, but your body's much healthier because you now have 5 more pounds of muscle mass. So it helps to keep things, don't be so discouraged with that. Okay, balanced eating, this deals with having your blood sugar regulated well by making sure you're getting adequate levels of protein every time you eat. Protein slows down the absorption of sugar into your bloodstream. So kind of a typical meal would be, say, a palm size of say, a chicken breast, and maybe a half a cup, half a fist of a starch, like half a potato, and then a couple cups of vegetables, something like that. If you're having a breakfast, maybe have a spring almond, so you're getting eggs and you're getting some vegetables, maybe a cup of berries. So you want to make sure that that protein is there. When you sit down and have your bowl of cornflakes, your blood sugar level spikes high because there's no protein there. That releases a lot of insulin, which is promoting the insulin resistance. And then oftentimes it actually drops to the floor and you're craving, so you grab it. That's why you can't eat just one cookie. You're going like this all the time. You're stimulating your body to want more by eating in an imbalanced way. Then intermittent fasting. Intermittent fasting is a great way actually to break insulin resistance. And you can do it fairly quickly, a few weeks to a month, if you really are aggressive with this. I'm not saying to be aggressive with it to start. You can work your way into it. Basically, fasting is part of our life. We fast from, say, 6 p.m. to 6 a.m. That's what break fast is. We're breaking a 12-hour fast. Yes, people do eat before bed, which they shouldn't do, that kind of thing. But in general, if you're eating 3 meals a day and no snacks, then your last meal would be 6. Your first meal is 6 a.m. So that's a 12-hour fast. So if you can extend the amount of time before you begin to put sugar in your blood again, you'll then not have insulin being released. So the next step would be an 18-hour fast, which means skipping breakfast, having lunch and dinner, or eating breakfast and lunch and skipping dinner. 2 meals in a row within a 6 to 8 hour window, and then the rest of the time your blood sugar is not rising. And then if you want to go a little further, a 24-hour fast, 1 meal a day. My wife and I, periodically, we typically will do 24-hour fast 5 days a week, and then we eat on the weekends. So it's not a hard thing to do. People think it's hard. I can help guide you through that, but it's really a great way. And then this breaks that insulin resistance pretty quickly. And it also helps with weight loss, things like that. So I highly recommend intermittent fasting. Okay, so continue on with this. Exercise is very important. Aerobic is one of the best ones because that really helps to work on your muscles. 30 minutes of aerobics, if you can do that. It could be a 30-minute brisk walk. Just do something that's good for you. And even 7 days a week is a good idea with this kind of thing. Muscle has the same function as insulin. So muscle will take the sugar out of your blood and put it into your cells without needing to release insulin. So there's another way of reducing insulin resistance. Stress management, again, when you're dealing with the flight or fight response, one of the things that happens with the flight or fight response is, when you're running away, say, let's just say you're lost in the woods for 3 days and you haven't had any food at all, and a bear shows up. You need to run. Well, your body will bring sugar out from inside of you, oftentimes by dissolving your muscles, to bring it into your bloodstream so you can save your life. Well, when you're sitting there worrying about something or whatever, yes, your blood pressure is going up, your heart rate may be going up, but your blood sugar is also going up. There's a hormone called cortisol from from the adrenal gland that's responsible for bringing up blood sugar level when you're low. That's a life-saving function of the adrenal gland, and that's what it did in the case of the bear. But it can also come out when you're worried or when you're stressed. You now get a blood sugar rise, and your body's saying, I don't need this energy, and you store it away as body fat. And typically, with adrenal weight gain, it's on your belly. So that's the typical pattern of weight gain. So, and again, that can create more fat tissue, obesity, which then creates high blood pressure. And actually, the function of cortisol itself and the adrenal hormones causes, again, the high blood pressure. Some interesting information about our own internal thoughtfulness. One is considering practicing forgiveness and also thankfulness. This is the title of a study. The title is called A Change of Heart, Cardiovascular Correlates of Forgiveness in Response to Interpersonal Conflict. Conclusion of the study was forgiveness was associated with lower blood pressure levels and heart rate. So the question is, if you don't forgive someone, who are you hurting? Yeah, bitterness destroys your soul. And if you may have heard someone say, being bitter is like having a poison pill and taking it yourself instead of giving it to them and expecting them to be hurt by it. It's really very, very important. And then also for gratitude, thankfulness, clinical trials, again, these are clinical trials, laboratory trials, indicate that the practice of gratitude can lower blood pressure and improve your immune function. So again, it's stimulating the body in all the right directions. So practicing thankfulness and gratitude and again, forgiveness are really very important. Okay, so how do we normalize, continue, what else do we do to normalize blood pressure naturally? I mentioned before about deficiencies, so let's talk about solving some of those deficiencies. The omega-3s is one of the areas of deficiency. This is one example of a product we carry, Ultra Pure Fish Oil. We carry another called Ortho Omega. Generally, you want to be in the 3,000 to 4,000 milligram range if you're trying to deal with blood pressure from an omega-3 standpoint. Calcium and magnesium, again, magnesium is the component that helps relax your blood vessels, and magnesium technically should always be used with calcium because they're like brothers, they work together. So in this case, the 2 to 4 tablets a day would be, for the magnesium side, would be 250 to 500 milligrams of magnesium in those level of pills. Vitamin D3, I recommend the average adult should be on about 5,000 units a day. And then you want to make sure where you should be in the long run. Once you've been on that level for at least 3 months, because it takes time to stabilize what you're doing. And by the way, 3 months is a good rule of thumb for any change. If you go to the doctor and they put you on a statin, they'll allow 3 months usually, and then see if it's affected your blood cholesterol. Vitamin D, it takes 3 months to change. If you do make changes, like tell the doctor, I'm going to exercise, I'm going to do all these things, give me 3 months, and we'll see what's changed in that period of time. So with vitamin D, it's 3 months. And then if you do that and get your number, come and talk to me with your number. Don't have the doctor say you're fine. They look for H's and L's on their labs. As long as you're not an H or an L, you're fine. With vitamin D, you don't want to be just within normal range. You want to be midpoint or above, and I can help you with that. Vitamin K, again, I mentioned about the value in preventing hardening the arteries. 1 capsule a day with 180 micrograms. Other supplementation, these are things that you can use directly. They're not a nutritional deficiency. They're using herbs like you would use a drug. BP Manager is a product, tablet 3 times a day, that contains stevia, olive leaf extract, hawthorn, and lycopene. So there's a synergistic activity between these 4 things that work independently to normalize blood pressure, and they come together in one product. Berberine Balance is a product that helps in particular with insulin resistance. But it also has been shown to lower cholesterol, blood sugar in general, and blood pressure in general. But it shines in regards to the insulin resistance component, capsule twice a day. Clinical OPC is a grapeseed extract, again, a direct effect on lowering blood pressure, 1 capsule a day. And then stevia, you might have heard that as a sweetener. If you're going to use stevia, make sure it just says stevia on it, no other ingredients, other than maybe a flavor or something like that, but none of the other things. Some of them mix stevia with artificial sweeteners, some companies. So stevia itself has a blood pressure lowering effect and actually a blood sugar lowering effect. So it can be used just daily. If you want a sweetener and you need something, I'm saying you need to add it in if you don't use one. but that's an option if you want to do that. Now, when it comes to if you're on medication and you want to get off your medication, again, that's between you and your doctor. But the way you can do it is you can, without even asking permission to the doctor, begin to do some natural things. This is where having your own blood pressure cuff is important. Monitor your pressure. Know where you started before you made any changes. Let's say you're 120/80. You can do any of these things. And that includes doing these supplements, changing your lifestyle, exercising, losing weight. Monitor your pressure. In fact, you can even do the other supplements. Those would be, the BP Manager is a little more quick and a little more direct, so it's not going to be, well, I've got to wait to lose weight, it's going to take time, or I've got to wait to replete or fill in a magnesium deficiency or things like that. This is more fairly quick. So you want to monitor your pressure, and if you see it going down, then you talk to your doctor and say, hey, here's what I'm doing, I'm working on my diet, I'm working on my weight, I'm exercising, I'm taking some natural supplements, and here's where I am, and see what they say. But you want to, it's completely safe to start these right away if you want to try to get off your medication. And certainly, it may be a long-term process while you're working on your lifestyle, but at the very least, you don't have to be on the drugs that can cause some of the complications that I already mentioned. So in terms of monitoring this, there's some lab work that you might want to pay attention to get an idea of where you are. Certainly having your own blood pressure cuff, it's kind of like self-lab work, so that you can be sure where you are, and you might even take it into your doctor's office and have them check your blood pressure cuff against theirs and make sure you're on the safe side. And then in regard to the white coat hypertension, where you might be prone to going up, my reading is always highest when I go to the doctor. Well, keep a record at home, bring your record with you and say, this is where I am. You know, put down the time of day, put down the arm, what you got, and try to do different readings so they know overall, hey, you know, they're in good shape. And just because I'm high now doesn't mean I need to react to that or change your medication. So, so making sure you have accurate reading is really important. For asking the doctor to check, you want to make sure you check your blood sugar. Again, you're looking for pre-diabetes in that case. Hemoglobin A1C is a measure of long-term blood sugar control, so that would be a pre-diabetes case, or diabetes, of course, case. But in terms of early warning, if you see that going up, then you may see that diabetes is coming. Getting your blood insulin level checked, again, doctors may refuse to do that. Be insistent about that. And by the way, you can order your own labs. If the doctor says, no, I won't do it, then you can call Quest up and you can order it and go in without a doctor's order, go in, they'll draw your blood, they'll check it, and they'll charge you for whatever it costs. So you can go online. Yeah, it's legal to order any blood work in New Hampshire on your own without a doctor.
That's just blood work, like, let's say, oh, never mind.
Anything. Cholesterol, thyroid, anything you want to do, they can do it for you without a doctor's order. Get your total cholesterol measured. Again, high cholesterol can indicate hardening of the arteries, especially, you know, you want to look at your HDL, which is considered the protective cholesterol, and LDL is considered the potentially damaging cholesterol. Your triglycerides are a good measure of your blood sugar in relation to your blood cholesterol. Some of the inflammatory markers to look for, HSCRP means high sensitivity C-reactive protein. There's a regular CRP, C-reactive protein, that indicates whole body inflammation. So you could have arthritis and you could have inflammation because you have an inflamed joint. The HS is related to heart specific. The HS doesn't mean heart specific, it means high sensitivity, but it is heart specific for inflammation in the heart area itself. Homocysteine is a circulating amino acid that can be pro-inflammatory when it's not being processed out of your bloodstream properly. It's healthy, it needs to be there, but it's when it gets to be too high a level. Normally the cure for that is to increase your level of vitamin B6, B12, and folic acid, and that will generally, and if it doesn't come down, then you take more until you bring it down into normal range. Because again, it can be inflammatory, which can lead to hardening of the arteries. And if you want to give a more accurate health indicator of what's going on, there's something called a coronary calcium artery scan. It's an X-ray, low-level X-ray, and they actually can measure hardening of the arteries on your blood vessels in your heart. So it's a good way of, you know, doctors say, oh, I want to put you on statins. Well, let's figure out what's going on. Am I depositing this, or is it just, as long as it's circulating, it's not a problem. It's when it deposits is the problem. So this can help to reveal what is your risk going on here. So the coronary artery scan. And then when you have your your cholesterol numbers that I mentioned before, there's a couple of ratios to look at. One is you take your triglycerides number and divide by your HDL number, and you want to be 3 or lower to be in a healthy range. And the other one is to take your total cholesterol number and divide by your HDL, and you want 4 or less to be in a healthy range. By the way, exercise raises HDL. HDL is protected, so that's another benefit of healthy exercise. Okay, so we finished up. Any questions at this point?
What about vitamin C?
What about it?